everybody. Connor here, chilling, having some coffee at the Kookaburra in St. Augustine. What's up, Andre, if you're around? Um, so, to summarize how my clinicals have been going, at H2 Health, every once in a while I'm at Mandarin, and every once in a while I'm at Southside. The Southside location definitely is slower and a little more chill, and I've been able to kind of make like a rapport with the patients that I work there a little more easily because of that, so that's been nice. And then kind of like learning what to look for when people come in and how to ask a good open question to get the information you need for the documentation is kind of something that I'm trying to get the hang of now. And then documentation itself, we use Raintree, so I don't know if any of you guys are using that, but first day or two on that was definitely kind of tricky, and excuse the traffic in the background if you're going to hear that. I hope that's not too big of a deal here, but yeah, so documentation is definitely, I feel like, something that I need to grow on. And then the how, why, and what kind of question that you need to ask yourself for what we're doing and why we're doing it and how it's supposed to affect the patient's outcome and stuff. Know the evidence-based practice and apply it is definitely another thing that I'm trying to get the hang of. And Fonda and all the staff at the clinic have been really, really awesome, really helpful, and open to questions, but been definitely pretty busy, so kind of hard to ask the questions that you need to ask sometimes, but just got to power through that and do what you think is right, and go with what you know, and then also just like knowing not to do something if you don't know why you're doing it yourself. So definitely learning a lot and having a good experience all in all. Definitely excited for tomorrow and the next week. Just try and put the knowledge to the practice and see what I can do. I've got a workers' comp patient. He's a cop, and he's got a Liz Frank fracture, and I'm not going to say his name, but that's just the deal with him, and he's been really cool. We do like 2-hour sessions, and been documenting all that, and kind of, he's been a good example, someone that I get to work with, and so I'm gonna have to make a exercise program for him, or not a program, but add some functional activities for him, which will be good. Thinking about just adding some burpees and some bear crawls and stuff in case he ever gets into the situation where he's going to need to, grapple someone at some point, and get up and run, and all sorts of different crazy things could happen with him, so trying to cover all the bases with that. And then, yeah, patient population is so different. It's outpatient. Got some people who have Parkinson's and some people who just have rotator cuff repair that they're trying to work on, and just everything in between, like whether it's neuro or musculo or whatever, old or young. Definitely like seeing a lot of younger patients with postural problems and scoliosis, and just even like, yeah, juvenile arthritis. And I mean, technology isn't helping with that, so trying to work on abdominal strength for them, and try and pull that spine back in line, and do what we can for them. But all in all, it's been a good experience, and outside of that, just trying to work enough to be able to pay rent and still trying to just have fun when I can, but studying, practicing, and just keeping on. So I hope everybody's doing good, and I'll see what's happening in your videos.